Good day, have all the presents. My name is Veronica Vega. Work as medical doctor. On behalf of my colleagues and myself, it's an honor to share with all of you our experience using the Latin Questionnaire. This work was realized as the final project to the ergonomy master degree. It was done together Doctora Eugenia Herrera and Doctora Chari Gonzalez, and we are from Costa Rica. Our work, called Epidemiological Characterization of Musculoskeletal Pathology in Employees of a Paper Industry in Costa Rica. Due to the worldwide growth of the industry, we have had to adapt to different work patterns, which has led to an increase in occupational demands resulting in the development of musculoskeletal system disease. According to data published by the Pan American Journal of Health, musculoskeletal disorder pose a serious problem for the health of the working population, being the leading cause of morbidity and disability. In Costa Rica, we have very few epidemiological studies on work-related musculoskeletal disorders, highlighting the clear need for implementing new tools to generate more epidemiological data in our country. As the results, we decided to use the Latin Questionnaire as the epidemiological foundation of our story. The work was done in Polyart Impresores S.A. It's a company located in San Jose, Costa Rica, dedicated to paper industry manufacturing. It has 384 employees specialized in printing everything from clothing labels to medical device boxes, as you can see in the next video. Due to this type of work, they have high exposure to repetitive movements, manual handling of loads, and pulling and pushing of the same. In this company, they have 3 different work shifts of 8 hours each, with an effective 15 minutes break and 30 minutes lunch break. Just a second, please. The Latin Questionnaire interview was conducted with 51 individuals, including both male and females, ranging in age from 20 to 55 years, as it seems in this picture. Once the questionnaires were complete, the information was entered into the software with the following results. So in this graphic, it can be observed the most affected joint in the right upper limb in terms of the presence of a positive threshold and minor disorder is the risk in both genders, and we can see it here. In males, we observe a predominance of a positive threshold in risk region at 30%. Here is. For females, the presence of a positive threshold can be observed in the 3 joints, with 24% in wrist, 90% in elbow, and 40% in shoulders. In this other graphic, we can see the left upper limb. So results for the left upper limb, it was observed that in both female and males, there is involvement in all 3 anatomical regions, with the most common presentation being the positive threshold, where the wrist joint is the most affected anatomical region, with 33% in males and 38% in females. So there is. In the spinal column region, it is evident that both in men and women, all 3 anatomical sections of the spine are affected, both in positive threshold and minor disorders. In the case of women, the main involvement in the cervical and lumbar area, with 84% in both anatomical regions, while in men, the primary involvement is in the lumbar area with 37%, and the cervical area comes in second place with 20%. In this graphic, show the results of the right lower limb. In the worth nothing that there is positive threshold involvement in a 3 anatomical region of the right lower limb. For females, with the ankle, foot, and knee be the most affected area with both 24%. However, as you can see here, males, we can observe that the primary issue is a minor disorder located in knee with 33%. Just a second, please. In this case, compared to the previous graph, it can be concluded that women have a higher level in involvement in the lower limb, both in ankle, foot, and knees, with the same percentage value of involvement in both extremities. On the other hand, it is evident that the primary complaint of pain in men is the ankle foot has a minor disorder with 17%. Here we can see as a summary. It can be observed that in female, there's a high prevalence of positive threshold in the cervical and lumbar spine at 48%, followed by the left wrist at 38% and a lower incidence in the lower limbs at the knee and the ankle foot, both with 25%, 25 or 4%. Regarding males, the main prevalence is in the lumbar and spine at 37%, followed by the left wrist with a 33%, and finally, the right knee with a 70%. With the conclusions, based on the information provided, we can draw the following. First, in relation to musculoskeletal disorders, both men and women in the study populations are experiencing musculoskeletal disorders in the anatomical region, including the upper limb and the lower limbs. With gender difference, women seems to be more affected, particularly in the left wrist joint, where the majority of cases exhibited positive threshold. A specific area anatomical where discomfort is more prevalent include the left wrist of women and the lumbar spine for men. This conclusion suggests that musculoskeletal issues, especially in the upper limb and spine, are a significant concern for both men and women in the study, with variation in prevalence between genders and a specific anatomical area. Further analysis and medical evaluation may be necessary to address these concerns appropriately. So the Latin Questionnaire has been used effectively to assess musculoskeletal disorders in the study population. This concludes our presentation. Do you have any questions?